everybody. We are on section 14.2 and now we're on the central nervous system, and you can see I've got a picture of a brain and a spinal cord, the parts of the central nervous system. And you might notice that the brain has this looks like a kind of a whitish covering over it. And so our learning outcome is describe the location and function of the meninges. And what you're seeing, this covering, you can see it's been cut away right here. But the rest of this brain is covered with 3 layers of connective tissues, and these tissues are called the meninges. And the meninges are a protective layer. So one of the things, there's all sorts of protections in place to protect the brain and the spinal cord tissue, from our skull to these kinds of things like this, like the meninges. So it's protective of the surface, and you can see that the meninges completely surround. If we had like the brain and then the spinal cord going down, the meninges completely cover the brain and the spinal cord. So the other thing I have about that is that I told you there's 3 layers to the meninges, and the dura mater, I don't think I have that on your vocabulary list, but just to be aware, if you hear of that, some people will refer to the dura mater. It's the thickest and outermost layer of the meninges. And I'm going to give you a word in a minute that will make you think of dura mater. So, and to expand on that, just to give you a little more information, I want to go to the next learning outcome. It says, describe the location and function of the cerebrospinal fluid. And I wrote here CNS. This is part of the central nervous system. And the cerebrospinal fluid can be called CSF. CNS is central nervous system, the brain and the spinal cord. The cerebrospinal fluid is a fluid that is associated with the central nervous system, and it can be called CSF, cerebrospinal fluid. So here I have a statement. It says the cerebrospinal fluid circulates in and around the brain and the spinal cord. So if you look at this picture, the blue shows you where the cerebrospinal fluid is, and what you can see here is there's actually spaces inside the brain where you have some of this cerebrospinal fluid, and it's found on the outside, completely surrounding the brain, as well as the outside of the spinal cord. And there's a tiny little hole in the center of the spinal cord where cerebrospinal fluid is found. The cerebrospinal fluid is a colorless fluid. It's not red like blood, but it's made from blood. But the blood cells aren't part of the cerebrospinal fluid. It's like there's tissues in the brain that kind of filters a part of the blood out, and then it circulates, and that's the cerebrospinal fluid. And the cerebrospinal fluid then circulates in the brain, around the spinal cord, up through the center of the spinal cord, and then it gets reabsorbed back into the blood system. So it's circulating all the time, just like our blood, and we're always making cerebrospinal fluid and reabsorbing it. It's constantly being renewed. So what the heck do we have cerebrospinal fluid for? Well, so we said that the brain is surrounded by the meninges, between the brain and the spinal cord. Between the brain or the spinal cord and the meninges, there is cerebrospinal fluid. So there's actually liquid, a little bit of liquid, between the brain and the meninges, or between the spinal cord and the meninges. And so what that does is it provides another layer of protection. The cerebrospinal fluid has nutrients in it. It carries away wastes. It can balance the pH. It has to do, it's got some cells in it that help fight infections. So there's all sorts of protective functions that the cerebrospinal fluid is providing. But you also notice that if you shake your head, It doesn't really hurt unless you shook really hard, but it doesn't hurt despite the fact that you've got this brain sitting inside of your skull. Your brain does not hit against the inside of your skull, and that's because of your cerebrospinal fluid. Turns out that your brain is kind of floating in your skull. It's not just sitting there, it's actually floating, and the cerebrospinal fluid provides it with this liquid medium in which to float. If you took, I saw a video one time where they took they took some fresh brain tissue and they put it on a table, like let gravity take its toll on it, and it kind of squishes down a little bit on its own weight. So it compresses a little bit. But if you're floating in liquid, it prevents the brain from kind of squishing into itself. So the cerebrospinal fluid is allowing the brain and the spinal cord to float in these spaces rather than being knocked around on the inside of these bones. A couple other things I want you to notice about cerebrospinal fluid and the meninges. Remember we said the meninges are those protective layers on the outside of the brain and spinal cord. So you probably have heard of a disease called meningitis. Meningitis can be caused by bacteria or viruses. And if you get bacterial meningitis, some forms of bacterial meningitis can kill you within a day. It can be a very serious disease, cause inflammation and damage to the nervous system, and kill you. So if you're going to get meningitis, probably viral meningitis would be your choice because it's not quite as deadly. But bacterial meningitis is, and so if you get symptoms of meningitis, which are usually neurological symptoms. Maybe you're not talking correctly, you can't move correctly, you can't form words, your nervous system doesn't appear to be working normally. One of the things, and maybe you have a fever and a stiff neck, those also go along with meningitis. One of the things they are likely to do is test some of your cerebrospinal fluid using a technique called a spinal tap. So what they're showing you here is, remember, the cerebrospinal fluid circulates around the spine and up and into the brain and back. So what they do is they take a needle and they puncture it in the way lower part of your back. Because if you look at here's your spinal cord. When you get to the lower part of your back, there's only some nerves there. The spinal cord kind of stops in your lower back. So if you're going to take some cerebrospinal fluid, the safest place to take it is through this lower part of your spine, so you don't accidentally damage nervous tissue. So we call this a spinal tap, where you use a needle to suck out some of the cerebrospinal fluid, and then you'll go look at that in a laboratory and see if there are bacteria or viruses there. So you're testing if the patient has meningitis. Okay, so you have to actually poke through the meninges and then test the cerebrospinal fluid. Another thing that can happen with cerebrospinal fluid, it says, explain how abnormality in cerebrospinal fluid production can cause hydrocephalus. Water, hydrocephaly refers to brain, so water on the brain. So here they're showing you that a normal brain actually has some spaces inside. They're showing you here, these spaces are called ventricles. And we said that cerebrospinal fluid flows inside those spaces and around the brain and then down the spinal cord. The other thing I mentioned is that the cerebrospinal fluid circulates. It's always being made, it circulates around, and then it gets reabsorbed back into the bloodstream. So there's always a recycling of that cerebrospinal fluid. There are occasionally conditions where a patient doesn't reabsorb their cerebrospinal fluid effectively. They instead of the cerebrospinal fluid you make some and you reabsorb some. You have to do it at the same rate. If you make more than you reabsorb, you're going to increase the amount of fluid in the brain, and it's going to add pressure. Brain tissue is really delicate. So you start adding pressure on brain tissue, you're going to cause brain damage. And so here's an example. Sometimes babies are born with hydrocephalus. There might be a birth defect where something didn't form correctly, and they're making more cerebrospinal fluid than they're reabsorbing. And so you can see this baby's head is enlarged, and that's usually a very, very dangerous condition, can damage the brain, and can cause death. I remember having a student in class one time, and she had chronic headaches, and they were trying to figure out what was wrong. And this is something that can happen in even an adult, that turned out that she was making more cerebrospinal fluid than she reabsorbed back into her blood. And so she was getting pressure on her brain, causing these really bad headaches. And here's a condition, a surgery they can do where they implant a little tube into the spaces in the brain that can drain off some of that cerebrospinal fluid. And they run it from the brain down the throat into the stomach. And what they do is it just gradually drains off a little bit of that cerebrospinal fluid and keeps it from accumulating. And this student got one of those, got that implant, and it relieved her headaches. And you can imagine that would be a really serious surgery to have, but it is something that probably made a big difference in her life. Okay, so we always want to make the same amount of cerebrospinal fluid as we would reabsorb it. If you ever hear somebody who has a head injury, oh, you get in a car accident, you hit your head, but you feel fine. I'm fine, nothing's wrong. You don't want to go to the doctor. They keep saying, no, you have a head injury, you should go get checked. And you feel fine. One of the things that can happen is you can get, you hit maybe you got a concussion, you might get some inflammation in the brain. And, but you feel fine because, just like if you twisted your ankle, the inflammation is not its worst immediately. It takes time for the inflammation to build. So you're in a car accident, you hit your head, you feel fine, so you go home. But later on, a couple hours later, you start getting a headache. That could be that the inflammation in your brain is preventing you from absorbing your cerebrospinal fluid. So you can get hydrocephalus, you can get pressure on your brain, and that can cause brain damage or death. So typically, if a person gets a brain injury, like it's in a car, as if, like they were in a car accident or something, it's always good to go to the doctor's office and get checked to make sure there's not inflammation in your brain. And if you do start getting headaches after a head injury, you should get to an emergency room. It can be a very serious situation. That's where I'm going to stop, and we'll go on to brain in the next lecture.